right. Good morning, San Ildefonso. Sorry for the late start. Had a little human error with the technical portion. Just give a couple of minutes to see if anybody is able to join us. I know we're very late, but still wanted to take an opportunity to update everyone, let people know what's going on in the community and around the country. And at least we'll have this as a recording for later in case folks catch up later on the live stream. So I think I'll just go ahead and get started. Currently, I do believe we have 7 active cases here in San I. So today is June 30th, 2022. It's 11:31 a.m. And again, we have 7 active cases in San Ildefonso. That could be 9. Not to the board yet this morning. So code is still out there. We still need to practice good hand hygiene, clean our surfaces and doorknobs and things at home, cell phones, keyboards, computer mice, anything like that. And wear a mask when appropriate. Be around other folks. And if you go to public places, I'm still wearing my mask in a lot of places, specifically, the grocery stores, gas stations, anywhere I'm not consuming food or drink, I will still wear a mask. I'll still wear a mask going in and out of restaurants and whatnot. So, I know it's your choice to do that, but it's a good idea. And, pandemic hasn't gone away. So I want to still, get updated on those vaccinations if you're eligible. If you haven't completed the initial series, obviously we definitely want that. If you're eligible for that booster, make sure to call and schedule an appointment. So, see, as far as the state goes, New Mexico State, the COVID numbers as of yesterday, there were 188 people hospitalized for COVID-19. 22 are on ventilators. We had 4 new deaths and 1,129 new cases. We're still averaging for the state anywhere from, I would say, 700 to 1,000 new cases a day. And so, people are still experiencing COVID infection. They're still having breakthrough cases, even if they are fully vaccinated. However, it does the vaccines have made an enormous difference in the levels of hospitalization and ventilation needed. So that's the key takeaway here when it comes to vaccinations, is that we're trying to reduce the number of people who are needing hospitalization, and especially the number of people who are needing ventilation. So we have to remember ventilation it's a life-saving effort. It's not the optimal level of care. We want to prevent that. So I also want to update on a few other things that you should know about. You need to be worried about as much as just have the knowledge about these things. Monkeypox, for example, we are still a monkeypox-free state as far as we know, which is excellent. There are 351 cases in the United States. That actually probably jumped from 300 to 351 over the past few days, perhaps from over the weekend. The states with the largest case numbers are California. They have 80 cases. New York has 72. Illinois 46, and Florida with 35. Following up with less than 20 cases per state is the District of Columbia, or Washington, D.C., in the state of Massachusetts as well. So we just want to keep an eye on that virus. It's pretty unpleasant looking. So hopefully that we can get the country can get those cases under control and it won't continue to spread. As far as seasonal flu cases go, those numbers are decreasing. Turns out the data and the information that they got back on the flu vaccine indicates that this past flu vaccine formulation was actually more effective than they expected, which is great news. Nobody likes getting the flu. It's unpleasant, and for some it can be really damaging, and for the rare it can be fatal, but we want to avoid that. So it's good to hear we've had a good vaccine this year. Every year it changes a little bit. And then I wanted to move on, just do a little talk about food safety. You may have, if you've watched previous podcasts, you may have noticed I spoke about the peanut butter issue, the salmonella outbreak. That is still active case investigation in the United States. Any Jif peanut butter, you want to check the lot date number on your container and check that with the FDA. Have specific lot numbers that indicate you would want to dispose of that peanut butter to prevent getting sick. Another item that was going around was fresh organic strawberries. There were a couple of brands which aren't typically common around here. There were Fresh Campo and HEB. People who purchased between March 22nd and April 15th of this year. Some folks like to buy strawberries and freeze them and use them later. You would want to dispose of those due to hepatitis going around. So the CDC actually has a website dedicated to foodborne illness, and they update that regularly. It's a good site to go to every once in a while just to see what's going on. I know in this region, in the past, we've had some foodborne illnesses going around that have impacted us here in New Mexico. So it's a good idea to stay abreast of those items. That's really all I have for the update today. Today will be my last day here at the Pueblo, and I know I already spoke on this the last podcast, but I just wanted to say again how appreciative I am of everyone being friendly and welcoming, and I don't think I'll ever forget my experience here, and I certainly won't forget the community here and my coworkers. So I thank you. And does anyone have anything you'd like to add? Okay. Nervous. Unmuting. So, and Victoria, if you have anything over there that you wanted to add, Claudia, you have something. Go ahead.
Okay. Rebecca, thank you very much for being a part of our team. I enjoyed working with you and asking you for information or advice on clients since you've been here, and good luck in your new endeavor, and you're always welcome here. Thank you.
Thanks, Claudia. That means a lot. Thank you so much.
I turned it down. Okay. Can you hear it?
Yeah. That's not that bad.
Okay. I don't have much to add. We had a couple of events take place yesterday. We had the activities take place at the Learning Center. So I'm working with Healthy Kids, Healthy Communities to bring more environmental and then indigenous approaches with the children at the Learning Center. So that was a nice activity. I got to meet some of the kids, talk to some of the kids, and so we'll be going forward with additional activities. Yesterday we were also able to gather a few gentlemen to talk about men's mental health. There were really good topics we touched on. Troy was our presenter, and I felt like it was information that could have been useful for a lot of people. I mean, I sat in on the conversations or the information Troy provided, and it was really useful to learn, or even to have these topics about mental health and substance abuse and overall general health, how the brain works, the hormones, everything that's taking place in our bodies. I forgot about what some of these, how our body works, and to have that refresher and have conversations with Troy was really helpful yesterday. So I learned a little bit more about myself, but I also learned about how men are understand and take in this information. We had a really good group who were interactive, so it sounded like we met, or there was more individuals who were reached. So they were interacting, they had questions. It was really nice to make sure that we were able to target a few people instead of kind of having this huge event that didn't reach anybody. But we had a lot of interaction, a lot of questions, and we stayed there. We stayed here at the Health and Human Service building pretty late. The event was also catered by Rudy's, so these gentlemen had barbecue, we had good food, we had brisket, cobbler, corn on the cob, iced tea, just some of the things that we figured, or the CHR group felt the men that would entice individuals to come out and participate. Yeah, it was good. So good job for putting that together, and good information from Troy. So hopefully down the road we'll have a few more presentations. We haven't got anything. We do have an event coming up. It's on Santiago Day. We're still planning and preparing. There's quite a bit that we're trying to put together, organize. So that's what we have to look forward to next month. And yeah, that's it.
Awesome. Yeah, Santiago Day sounds like it's going to be a lot of fun. I'm going to see if I can try to come up for that. I'd love to see everybody again. And, I don't want to miss out on that. See how if we can swing that. Yeah, so I mean, I don't have a lot else to add, but that sounded amazing. That on the barbecue for sure. Especially Troy talking. He has a lot of knowledge in so many areas and a lot of information to share. So I'm definitely miss having him as a team member, and everyone else as well. So I don't know if we have any viewers out there right now, or maybe people will be watching later. But I think we're going to wrap this up. I wish everyone a wonderful day. The sun is out. The skies are beautiful. Enjoy some fresh air. Weren't able to walk this morning. Get out and go for a walk later.
Safe 4th of July.
Oh yeah, and have a safe 4th of July. I know
that, and mask up. Wash your hands.
Definitely, lots of hand washing. Let's not share drinks or anything. mask up if you're going to be in close quarters with folks, and stay healthy and safe. Remember that it's hot, and we don't have, we kind of live in a drought now. So even though it's monsoon season, still got to be careful if you're going to light fireworks. Please be safe and careful. And I thank you all, and have a great day.